It's really an exciting time for patients who have melanoma, particularly the high-risk patient population. It's also very exciting for the treating physicians because we have great options for patients. It's really been a revolution, both at the stage 4 setting and now in the adjuvant setting. The next group of trials will look at high-risk patients, but in a different setting. So the high-risk stage 2 patients that don't have lymph node involvement, particularly if they have thick tumors and ulcerated tumors, would be good candidates for adjuvant therapy because of their risk profile. And there will be a interesting immunotherapy trial for these patients that will be starting pretty soon, and that would be using pembrolizumab in the adjuvant setting versus a placebo. Probably the other important thing for this patient population is to look at biomarkers moving forward, trying to identify better biomarkers to identify which patients are most likely to relapse, and then have biomarkers that would predict response to specific therapies beyond a BRAF mutation. So this is what we're looking for in the long term, is better markers to identify risk for relapse, and therefore we can target these therapies to the highest risk patient population and spare the patients that are already cured any potential toxicity. And then predictors of response to therapy will help us decide which particular therapies to use, whether it's immunotherapy based or targeted therapy, or maybe in the future, combination of those two together.